Early on during the pandemic, President Trump touted the anti-malarial drug hydroxychloroquine as a treatment for coronavirus. Now, an article in Vanity Fair puts the spotlight on an alleged plan by the administration to distribute the drug nationwide before its effects were completely verified. Here with us now is the writer of that article, investigative reporter for Vanity Fair, Katherine Eban. Katherine, so great to talk to you. Thanks so much for joining us.
Thank you. It's a pleasure to be with you today.
So your headline is a quote, "Really want to flood New York and New Jersey." Where is that quote from?
So that quote is from an email that was sent from Brett Gerard, who is an HHS official, to colleagues. And basically what he is spelling out is the desires of the White House call. The White House had a plan to essentially go around restrictions that were set up on these drugs, that they would only be monitored in a hospital, in hospitalized patients, and flood the zone with these drugs, get them out to drugstores, get them out to pretty much any patient who would want them, who could get a doctor to prescribe them. The problem with that is these are potentially dangerous drugs. They come with serious risks of cardiac problems, and they're unproven in the treatment of COVID-19. So, there's no proof that they work. But what's clear from the documents I obtained is that the White House had developed a plan that they were announcing from the podium. These drugs were a potential game changer and a cure, and behind the scenes, they scrambled to circumvent regulations and make these widely available to patients.
So, Katherine, can we talk a little bit about that? The president comes out in March, touting the effectiveness of this drug, the importance of this drug, how he really likes it. And then you describe in the article, as you said, a scramble, this sort of mad flurry of emails going out to try and influence people to make this drug more widely available. Can you give us kind of like the short version of what happens behind the scenes?
So what happened behind the scenes is the administration's top health officials are told, this is going to be the plan. We have to essentially waive regulations to make it happen. We have to, get these drugs into drugstores despite restrictions, and they push back. Alarm bells go off throughout the administration. They push back against the plan, and they manage to get a restriction in place, an emergency rule, that these will only be used for hospitalized patients. So it seems like problem solved. But no, at the behest of the White House, officials working closely with the administration keep pushing and tell these health officials the rules matter not, and what we're going to do is distribute these drugs to drugstores, even though the rule says they should only be used for hospitalized patients. Deeply concerning to the top agency officials in charge of safeguarding public health. A lot of pushback, a big fight.
And then eventually we found out a couple of things. A, that hydroxychloroquine was not a miracle drug. There were also people, I was familiar with this medication because I was given it when I was based in Africa, when I was a West Africa-based correspondent. And as we pointed out at the top, it's an anti-malarial drug, but it's also used for other things. And some of those things are very serious illnesses that people take this drug for. So we started to see a run on this medication for people who didn't necessarily need it because the president had touted it as a drug that could potentially cure COVID-19. So then you've run into the situation where health officials even are knowingly pushing a drug that could, A, have serious side effects, and also, B, cause people who really need it to not be able to get it.
Right. I mean, the promotion of this unproven remedy from the White House podium had, geopolitical consequences for this drug, and a, gold rush by companies aiming to get this drug into the national stockpile, into the hands of the administration, But I think the most critical issue here is that President Trump was promoting it as a game changer. His administration officials behind the scenes set up a plan for wide dissemination of this drug against all of the warnings of top health officials. And then basically they started trying to sort of navigate around the rules, ignore the rules, so that this could be in drugstores. You know, you have a situation where the drug comes with risks. Its utility in fighting COVID-19 is still unknown. You know, the only way to figure that out is through clinical trials, which is what is happening now with a lot of different drugs. You know, but to hail something as a remedy, really without scientific evidence, and then to ignore safeguards, I think is the critical issue here that drove my reporting.
Katherine, before we let you go, so one thing that's become noticeable, you don't hear the president talking about this anymore from the podium. And that's perhaps a good thing, but I just wonder, for the millions of people who heard him in the early days of this pandemic, tout it as something that could be potentially groundbreaking, something that essentially could be a miracle drug. And my heart goes out to people who perhaps thought that this was the answer to their prayers. And it turned out, at least as far as we know now, I know it's still being tested, and it could very well end up being something that can be reliably used for the treatment of COVID-19. But it's just striking to me that he doesn't mention it anymore, even though he spent days and days and days talking about it from the podium.
Well, that's right. And, you know, some of the studies, some of the results that are emerging now are showing, in fact, that this drug does come with some very serious risks. There was a a hospital study which showed that veterans who took this drug had a higher probability of death than those who didn't, who had COVID-19. So, you know, it's looking absolutely not like the game changer that the president claimed it was. And so, you know, he's quieted down his talk about that. He moved on, much to the dismay of many, to disinfectant, you know, Clorox and Lysol for this, which is absolutely poisonous. So, you know, there's a lot of desperation out there. There are people who are looking for a miracle cure. They hear someone as powerful as the president talking about it from the podium. You know, there is a willingness to believe. But really, the only way that we can figure out what works is through a rigorous scientific medical process, and those processes are underway. In the meantime, I think it is important to remain skeptical about cures that people are proclaiming.
Katherine Eban, thank you so much for your reporting. Appreciate it.
Thank you.